Now to our focus segment. Joining us via Skype from Cross River State is Dr. Inyang Asibong, Commissioner for Health, Cross River State. Thank you so much for joining us on the program.
Thank you.
Now tell us about the progress made so far in the healthcare sector with particular regards to infrastructure.
Of course, in the Cross River State health sector, led by, of course, the governor, Senator Museveni Ayade, infrastructure particularly, we are currently building 3 mega hospitals, quaternary hospitals across the 3 senatorial districts of Cross River State, 1 in the south, 1 in the central, 1 in the north. These are Ayade Care Referral Hospitals. It's actually built in line with the Cross River State Health Insurance Scheme that was launched by the governor last year. And we're supposed to cater for the deluge of people that are going to be coming in following the launch of the health insurance. Because with this health insurance, we are just going to be paying 1,000 naira monthly, and you can access unlimited healthcare. So we know that a large number of people are going to key into this. We are a population of over 4 million people. So the general hospitals and primary health centers we have currently may not be enough. And also we are building the Kala Farm. Calabar Pharmaceutical Company is 95% complete. The Vice President of the country has visited, the Minister for Health has visited that place, and it's going to be commissioned anytime soon. It's going to be manufactured drugs, of course, that will export to Cameroon. We know, of course, about the deep sea ports and the superhighway. So we are also going to be exporting our drugs through the deep sea ports, and of course also to other states in Nigeria.
Speaking of access, what is the state right now, and how are you planning to improve the level of access that people have to all this that you've provided?
Of course, definitely, we are talking primary healthcare here. Most of our people live in the rural areas, so we actually have, following, of course, in line with the Minister of Health, he came in and said the most important thing he wants us to do in the health sector in Nigeria is revitalization, renovation, and rehabilitation of primary health centers. So that's exactly what we are doing. We actually also wait for the federal government. Cross River State has rehabilitated at least 3 primary health centers across the local government areas, the 18 LGAs of Cross River State. The very first one was actually commissioned by Her Excellency herself, Hajia Aisha Buhari, and following that, we've been just moving in leaps and bounds, trying to get them all functional, get them operational. In fact, the ED, Executive Director of the National Primary Healthcare Development Agency, was here a few months ago, and we took him around some of those primary health centers. All of them are complete with tricycle ambulances. So as of now, we have 54 of them, because that's 3 per LGA times 18, 54 of them. So going into the next administration, the governor himself has said that he's going to have at least 1 functional and operational primary health center per ward. We have 196 wards in Cross River State. So we are aiming for 196 in the next administration.
Now, about the Health Insurance Scheme Initiative, which is the Ayade Care, tell us more about this.
Yes. So the Cross River State Health Insurance in the Ayade Care was actually, of course, accented to by the governor, signed into law by the House of Assembly. And in record time, the only bill in Cross River State and probably Nigeria that was actually launched the way it was accented. So it was launched by the governor, members of the EXCO House of Assembly members, and they also promised to adopt people. It's just about paying 1,000 naira per month. For 12 months, it's 12,000 naira. And the people that have actually enrolled into the scheme, currently we're in the enrollment phase. So the people enrolled into the scheme actually have access to health care, even when they do not have money in their pockets when they are sick. So that's the whole idea, providing a shoulder for your brother to lean on. So even if you pay the 1,000 and you're not sick for that month, there's actually somebody that's going to be sick and may need more than 1,000 to take care of himself. So it's all about sustainability, because before now, we're actually having the free medical care for women, pregnant women and children. But you know how it is with free things in Nigeria, it's not very sustainable. So the world has actually moved, Nigeria has moved, and Cross River State has moved towards health insurance, where at least you should bring out a token from your pocket to take care of your health needs.
Now, I mean, there will definitely be some people who cannot afford even that 1,000 naira per month. What happens to such people?
Yes, so that's what we're talking about. That's what I'm talking about, adopting. Can you hear me?
Yes, please go on.
Okay, so we are talking about adopting a person. We had, of course, the House of Assembly members the National Assembly members, the governor, political appointees, everybody. The governor said everybody should adopt a person, adopt a village, adopt a ward, adopt a community, and even adopt a health center. So these revitalized health centers, we have our National Assembly members, we have our top businessmen, we have companies adopting primary health centers. So you own that health center. Whatever is wrong in that health center, we come back to you. And of course, for the people that cannot pay, we have what part of it for the vulnerable. So that is going to be paid through the CRF, the Consolidated Revenue Fund. 1% of it actually goes to the health insurance from government for the vulnerable. And the vulnerable, of course, you have pregnant women, you have children, you have the elderly, you have disabled people. We know that these people cannot pay for themselves. So government will definitely take up this part.
All right, thank you very much for joining us on the program. That's Cross River State, Dr. Inyang Asibong, I beg your pardon, Commissioner for Health, Cross River State. Thank you so much for joining us.